Hi guys, today's a special day and you're gonna see why. Hi guys, this is us waiting to go into the white coat ceremony. Say hi guys.
I'm not in it. Hi.
Guys.
Hi guys. I'm James' best friend. Hi. James. I'm Sonia. Hey guys. YouTube. Oh, where was it? Like, comment, share, and subscribe.
I just want to live this life. I just want to live
This is a height of what James was waiting for. This is what it is. Oh, it's tasty. Okay, good. Collier.
Hi guys, hope all is well. The last video you just witnessed was the swearing-in ceremony or the white coat ceremony for the Faculty of Dentistry, University of the West Indies, Mona campus. So this is the penultimate step to actually finishing the Doctor of Dental Surgery or the DMD at this university. As you know, it's a 5-year program. We don't really have an internship, although you have the option of doing an internship if you want. So yeah, I got a white coat. It's not really new to me in the sense where for medicine here in the Caribbean, we really don't get a white coat, but I've worn white coats before, but at the same time, it was a good chance to really bond with the class. So that was a good experience from that point of view. But the fact that we got the coat shows that the end is near. And that was something that was a good feeling because I don't know how much more of this I could do. But yeah. So what's new? Besides the white coat I just told you about, I've been in contact with universities abroad in Canada this week, specifically University of Manitoba. On its website for oral surgery, it says that it accepts international graduates, which was interesting for me, so I'm an international graduate. So I was in contact with the head of the program who was telling me, gave me all the information, told me, he was very polite. He basically told me that yes, we do, but we don't accept. It seems as though with the information that he gave me, they accept permanent residents and Canadians who have gotten their dental surgical degree outside of Canada. That's a very big parameter or a big factor that determines if you can get into the program. So it seems as though permanent residence and Canadian citizenship will play a very, very vital role in getting you into a program in Canada. I also was in contact with a group of persons, of internationally trained physicians and internationally trained dentists, to get information with regards to how to get into programs in Canada. I was placed in contact with a gentleman who did his dental degree in Poland, but he's a Canadian citizen of Italian descent. So he actually didn't know much about getting into the program with an international degree because he's now trying to finish his AFK or his NDEB exams, which is the Canadian board exams, so that he can go ahead and start to practice as a dentist in Canada. So what I will say is that that process to become a practicing dentist in Canada is actually longer than in America, which is interesting. Unless you go back to the 2-year program, the 2-year advanced standing program for dentistry, which I have no intention of spending that kind of money right now. So that was that from University of Manitoba. It's still an option, but I actually found out at University of Manitoba that you pay. So for international students, you pay $22,000 to do the oral surgery program per year. And for locals, you pay 8,000 Canadian. So that's another thing that's a really big no-no for me. I'm not really about paying any more money except for exams that will allow me to get into training because I'm looking to train right now. I'm not looking to go further into that. Right now, I'm in an office in Crossroads. It's an office that I've been working at for quite some time. It's not very lucrative. I waste a lot of time. I sit here, but I mean, it's something. I've been looking for a cheap spot to actually set up my own office again because this is not actually very viable right now. And the plan was, since I have Mondays off, to work Mondays, Saturday and Sunday. I haven't found anything that was reasonably priced, so that was kind of frustrating. And the one place that I did find, it went very quickly. And it went quickly because I was supposed to go, say for instance, I was supposed to go and see the office on Thursday. I had a patient that took me over 6 in the afternoon, and then I had to come here after that. So when I got home, I messaged the lady. I had the office and told her, well, you know, is the office still available? She told me the office was already gone. So that office would have been ideal in the sense that it was the most reasonably priced office that I've seen in Jamaica. Pretty much. Most times people want to gouge out your eyes for rent, and your office was reasonably priced because it was in a pretty semi-rural area. So that was a bummer. As it pertains to how I'm progressing in school, I'm not doing as many fillings as I wanted. This week I made some progress. I was hoping to get at least 6 or 7 fillings done a week, and nowhere near that per week. But this week I'm actually setting it up for myself so that I spend my days here when I'm not doing much, actually setting up my patients for the week. So I also screen too. So if I see patients and they come for medicals, I look in their mouth to make sure that their dentition is fine. And then what happens is that if I see a lot of things that need to be done, I will either revert them to myself or to a dental office that I know, which is not far from here. So I saw this child today that needed a lot of fillings. So what I've done is taken the information, told the mother the price, and hopefully I can bring that child in to do to get my peds quota out of the way, as well as to get some fillings done for this patient, because about 6 or 7 fillings I saw in the mandibular region alone. Not even the maxilla, just the mandibular region alone. 6 fillings, 4 were on permanent teeth, 2 were on primary teeth. So that's a lot of qualifications, a lot of quotas that I can get, because this thing is about quotas. And if I can finish that care, that's a completed treatment chart, which is what I hope to do. Yeah, so I screen and I funnel them to me at the University Dental Clinic. So I'm hoping that the person told me that in another couple of weeks they'll get the money, and then we can move from there. In terms of finances, nothing has changed. So I'm not even going to go there. In terms of this channel, it's growing. I've reached 1,000 subscribers, so thank you guys for subscribing. I just want to thank you for watching, and any questions you have for me, you can contact me and I'll answer whenever I can. Most times I answer pretty quickly. So enjoy.